Good afternoon, everyone, and welcome to the third in our Safe Return series from KC Rising. Today, our topic is returning to the workplace, childcare, and mental health support for employees. My name is Molly Weaver. I am the Senior Director for Talent Acquisition for Children's Mercy here in Kansas City, and I'm responsible for our hiring of the amazing people that give care to the children of Kansas City. And it is my honor to join you today and to lead you through this particular topic. And a little bit about KC Rising. It formed in 2015 to help Kansas City grow faster and more intentionally in a business-led, metrics-based, long-term focused. KC businesses are positioned to lead this charge by nurturing partnerships and cultivating innovation. We amplify what's going on in the community by aligning corporations, foundations, nonprofits, governments, educational institutions, human services groups, civics leaders, and other members to accelerate the future of inclusive regional prosperity for Kansas City. To accomplish this, Kansas City relies on a distributed implementation model, allowing for a multitude of leaders and teams to work toward a shared vision of regional prosperity. Guided by the steering committee composed of business and education leaders, KC Rising concentrates its efforts on 7 pillars of prosperity. So those pillars are connectivity, effective and accessible transportation, and internet options for economic mobility, neighborhoods, healthy, safe, and attainable housing options to allow people to build better futures, enterprise, a robust entrepreneurial ecosystem to spark scalable businesses and leads to breakthroughs that can transform the economy, and industry, and building on our strengths as a region to attract, grow, and retain globally competitive businesses. I host a lot of candidates to Kansas City, and they're always commenting about how many businesses are based here that they just really didn't know. So I think Kansas City keeps that kind of a secret. So also inclusion. Our economies thrive through increased participation when everyone has equitable opportunities to advance. Education, learners of all ages need equitable access to continuous, innovative quality education. And culture. When I think about the greater future for our city, it's not about one industry, one company. It is about, or one community, it's for all. And I say, we all work together to make all boats rise. So as an employer, the challenges and opportunities that have faced HR professionals and others across the city and in fact across the world in hiring and retaining staff during a pandemic, in my case, both essential and non-essential workers have been many, and we have pivoted to work from home with kids. I can't imagine how many of you haven't had a Zoom call with at least one child, and helped our employees deal with the wide variety of stressors, from becoming teachers to pandemic stress to caring for others and themselves. In our case, and in most healthcare workers, it's been forcing our people to remember to take care of themselves while they're so focused on caring for others. So this current economic crisis has affected everyone. However, there has been an uneven impact where some populations have been harder to handle this. So our Latinos were hardest hit by the economic shutdown initially, but they also saw the quickest improvement, although this has stalled recently. The Black unemployment rate continues to be the highest among all racial groups, and at 9.2% is 1.7 times higher than that for whites at 5.7. Our labor force participation rates have dropped across the demographic groups, but women of color appear to be dropping out of the labor force at higher rates than the other group, likely a result of good childcare options. These statistics and more are available in the latest economic forecast on the KC Rising website. As we move into this webinar, please note we will have plenty of time for audience Q&A at the end, and please make sure that you put your questions in the Zoom Q&A. We look forward to taking them. It is my pleasure this afternoon to introduce you to Carolyn Watley. She's the Vice President of Community Engagement at CBIZ. In her role, Carolyn focuses on public-facing business development initiatives, board participation roles, and community stewardship. Carolyn is also the KC Chamber Board Chair. Welcome, Carolyn.
Thank you, Molly, so much. Well, as Molly said, it's been a very interesting year or so for employers and their HR and benefits and legal teams. We've seen this year that benefits are increasingly more important than ever, and employers are doing everything possible to ensure they have strong offerings to meet the needs of their employees and to be attractive to new employees in these ever-changing circumstances. Employers have instituted safety protocols, dealt with right sizing, managed through extensive new legislation regarding coverage for COVID-related expenses, adapted to new leave policies, COBRA and flexible spending changes, and are still dealing with issues related to vaccinations, et cetera. At the end of the first year of COVID, we know for certain that this all has taken a toll on so many and has challenged and impacted our mental health as we juggle the responsibilities of work under these conditions, either at home or at the workplace. We are caring for our children, as Molly said, dealing with remote learning and social isolation with our students as well. We're caring for our elderly family members and those with health challenges, et cetera. The ever-changing circumstances make it challenging to settle into any kind of a routine at all. And our frontline workers have been serving all the rest of us while juggling their own needs also. So today there's a strong focus on overall well-being and mental health as the stress of the past year is felt by so many. Employers are searching for and adopting new solutions for employees to help manage through these issues. We have an awesome panel of experts today who are going to share information that I know will be very helpful, and I am honored to introduce them to you now. So first we have Giovanna Rose, and over the past 20 plus years, Dr. Giovanna Rose has served in a variety of roles within the field of early childhood education. She's been a classroom teacher, early interventionist, home visitor, teacher educator, researcher, and advocate. In her current role as the Director of Early Learning for the Mid-America Regional Council, Dr. Rose works with her team to provide leadership and coordination to build a robust early learning system with strong families, skilled teachers, quality programs, supportive communities, sustained and sufficient funding, and multi-sector collaboration. That's a lot. She has served on local and state level governing and coordinating boards and currently holds an appointment on the first ever Jackson County Community Children's Services Fund Board of Directors. And we have Andrea Bernanke. Andrea is an Associate Vice President, Employment and Corporate Counsel at Black & Veatch. She is responsible for overseeing all legal aspects of employment-related matters, including the strategy and execution of employee-related relations functions, benefits, and supporting programs. Andrea is also the co-chair of Black & Veatch's Diversity, Equity, and Inclusion Council, which provides guidance and oversight for the development of policies, procedures, and programs to promote a fair and equitable workplace. Andrea collaborates and advises business leaders on employee relations and HR matters throughout the company. And Molly will be joining us on our panel as well. So here we go. So Giovanna, could you tell us a bit about the childcare landscape? This is obviously an important consideration as employers look to bring employees back into the office.
Thank you, Carolyn. And it's been interesting during this time how childcare has really risen to a lot of the discussions that we're having about employees, not only for the employees that have maintained their positions outside of the home, but also those that quickly transition to working at home. Childcare is such an important piece of the economic development puzzle, both for our young children, our birth to 5 that we typically think about being in care, but also for our school age at the same time. Many families didn't ever have to think about from September until May or June where their school age children were going to be. And then all of a sudden last March and April and then into the fall, we had to have some more discussions about what do we do with our young school age children who can't be at home alone. During the course of the last year, we have unfortunately seen quite a loss of childcare seats. So while at the same time we were looking to build seats that are available for those K-5 children who were typically in a school building, we started to see closings and permanent closings of childcare programs. You can see on your screen those closings that have happened, and as of the end of February, we've lost over 3,200 childcare spaces, and we've had 130 childcare programs that have closed during that time, and those are programs that have considered their doors closing permanently. Some of our programs remain temporarily closed, but if we look at these numbers, and you can see which counties are a little bit harder hit. Part of that's because of the need that is in those counties, but part of that is then looking at what does that impact mean when it comes to classrooms. And so this would be from infant toddler classrooms all the way up to our entering kindergarten classrooms. And so if we just did a conservative estimate of about 15 children per classroom to take to account all the different ratios we have, we're looking at a little over 200 classrooms that have been closed. And that's a little bit of a more tangible number. And if we look at the workforce, who is predominantly women of color, we're looking at about 400 teachers that have also, or teacher assistants that have been displaced during this time. And so while we're seeing that need for those frontline staff to have that care that is actually in person, we're seeing some of that decrease in the community. And our work at the Mid-America Regional Council, along with a lot of our partners, is how do we help programs to open back up, or maybe to open in an area that was previously underserved. Before the pandemic, childcare was in a fragile state. There's a lot of pieces that are sometimes difficult with addressing care for families. And so moving into the pandemic, it created a little bit more of cracks in that fragility. And so we've had to think differently. We have more women that are choosing to stay home disproportionately from men. While we do have men that are entering into more of that caregiving role, we've still seen that it's more of the women that are either pausing their career or stepping out, or juggling those boundaries of what it looks like to be working at home with children as well. And so while we're trying to address how do we create more access to affordable care, I think there's things that employers need to be thinking about when it comes to caregivers that are a part of their workforce. One thing is that we have to keep in mind that our demands are intermingled now, and they're competing for attention. So a couple of days of the week, I drive into the office, and that gives me that clear separation between what's happening at home and what's happening in the office. However, for our workforce that has been working at home with children, the boundaries are a little more difficult. It's harder to sometimes put those pieces in to clearly differentiate between what is your time for work and what is your time for being a parent. And so some things that we can do to alleviate that stress is really thinking about, if you have the capacity and the work lends itself as those flexible work hours, how do we focus on results over routine? And how does the leadership really signify that it is okay to work on unconventional hours? And so modeling that. So modeling that for your teams. And so my children are in 4th and 7th grade, and every Monday they have a virtual learning day. So that's my day to be at home and mark out when it is that I am available and when I need to be tending to their needs, and then fitting in some of the work that I need to do at other times. So modeling that, I think, is an important role that leadership can play. I think the other piece is to be strategic about the wonder of face-to-face. You know, what really needs to happen face-to-face, and what can happen in these new ways of working that we've learned. Other things that I've seen done is creating what they call kid calendar alerts. And so a way for parents or caregivers to alert colleagues on their calendar to times when they're caring for children. So if you have an infant or a toddler at home, there are really routine times to go down for a nap or to have a snack or a meal that we want to make sure we honor that time for those parents to be able to attend to their child in that way. The other thing, and Molly mentioned this, is that we're seeing more of our families in the back of our Zoom call. I'm in my office today, or else you never know who might pop up behind you. And so part of it is just acknowledging them, saying hello, and it's okay if they pop up. And then the other thing that is helpful for families, particularly as they're trying to navigate those intermingled boundaries, is to really cultivate those opportunities to connect. How can there be those times where employees are able to get together to talk about what they're doing or what's happening in their schools that is changing, what's going on within their home piece? We have seen some success. We've seen mothers that have had young babies during this time that have been able to successfully navigate being at home with an infant and a toddler while also being productive with the work that they need to do for their employer. So how do we continue to do that? One thing that has changed within the landscape of early learning is that as we talk to our providers, we're hearing from some of them that they're having a harder time finding infants and toddlers to fill their seats. If any of you have had young children, you'll know that this definitely is a change in the tide for that. I keep saying if you need infant toddler care, now is the time to find it because there's a definite need. And we attribute that to more mothers working at home with their young children as well. So as we look at the landscape, we're not where we need to be. We weren't where we needed to be before the pandemic. We're a little bit further behind when it comes to options. And so we really need to work hard to support our families and continue to be flexible as they are still navigating being an employee while also being that caregiver in a new setting.
Thanks so much, Giovanna. That was outstanding information. And Andrea, can you tell us a little bit about how Black and Veatch is providing employee support?
So thank you very much. I appreciate that. And great comments, Giovanna. And I guess I'll kind of start with some of the things you were talking about. You were referring to the modeling of the behavior. So we went to a flexible work schedule almost immediately when our offices were shut down. We had, I suppose, the benefit, we're a global company, so we had been following the COVID trends internationally for quite some time before it had kind of really hit here. So we had already gone through office closings and what does that look like? So we got to be, I suppose, a little bit ahead of the curve on that as to what to expect if we did that. But of course, this is a much larger workforce here. So we did, when our office is closed, we moved to of course, a working from home model and a flexible model, which, you know, our communications from our CEO and our executive committee were very consistent in, look, this is a time we all need to be understanding of people's schedules. This is something new. People, like has been commented on, people have children at home now. They weren't expecting to have children at home. They're still trying to get their jobs done. And we have the additional stress of just the pandemic. We can't forget that that's kind of an undercurrent here is that there is just the health stress behind all of this to top on everything else. So the flexible schedules, we allowed flexible schedules. We told people to work with their managers. We saw it happen very quickly, that people were very agreeable to working with these different schedules. Now, again, we probably have the benefit of being a global workforce because we've been used to some kind of bizarre schedules. When you're working with people overseas, you need to flex your schedule a bit anyhow. So we were seeing a little bit more of that being modeled at the top level. But the other thing is we did offer time off. So we offered, people could take regular time off, of course, and we were very flexible with that. We also offered extended leaves of absence, which is obviously not ideal for everyone, but it is a short-term solution for some people who over the summer had immediate childcare needs they needed to deal with. And not just childcare, but caring for people's parents and loved ones as well, because we saw that as a huge issue. Also, people who weren't necessarily in nursing homes, but needed more medical care, that aging parents and whatnot. And that became a stress that people were then juggling children at home and caring for aging parents. But we again, the flexible schedules is about all we thought we could offer, but we continue to offer it. And I guess from the modeling standpoint, we not only offered it immediately, but we rolled that into, by the fall, we were noticing our productivity was actually really good and people really enjoyed having these flexible schedules. So we rolled this into an ongoing long-term business model. So our business model now moving forward is we have 3 different tiers of professionals, I suppose 4 actually, but one previously existed, which is a resident who is somebody who will return to the office full time, a flex person who will return to the office 2 to 3 days a week, and then a mobile person who can come into the office anticipated about once every other week, but for the most part will be mobile and can work whenever and wherever. So we have a lot of guidelines around each of those to so managers understand how to manage that and who gets to decide these schedules. But that was really in order to show, first of all, to respond to our professionals who were really liking this and were very productive. So to respond to that request and to show that this is something that we are committed to and it actually does work. So, so that's one of the things we've been doing that we think that has been helpful. The other thing I would want to comment on is we've engaged several vendors, and one of them is our health advocate. And this again goes a little bit more towards the healthcare side, but this and potentially for kind of aging parents or people who need some medical care during this time. This is a service that our professionals' children, spouses, and their parents can use. So, and it's an advocate, it's intended to be an advocate for all healthcare needs. So you can call them and talk to them about insurance. They can help you walk through how to find some childcare options, and particularly if you have kids with special needs and things like that, to be an advocate to walk you through some of these processes so you're not doing it alone. So, and then our final thing, which we've always had, which is our employee assistance program, which I believe is run through St. Luke's, is an offering that we have provided to our employees for as long as I've been there. And it offers just general guidance, general counseling, and help on healthcare, childcare, legal issues, things like that. And that has certainly been used more now than it has before.
Thanks, Andrea. That's a lot. And you are doing such amazing things. And it's a long way from just being able to wear jeans at the office, isn't it? So quite the change.
That is true, yes.
So can you share a little bit about the safety or legal considerations in thinking about going back to the office?
Sure. So, we put together, really even before, again, we saw it in the United States, we put together kind of a COVID task force that was there to address all kind of COVID related international, local issues. And this task force has certainly changed over time. Initially, it was kind of watching TV, figuring out whether this is a pandemic, whether we should have people in the office or not, and going from there. It's now moved into, so it's kind of grown with every step of the way. We've had everyone from legal, HR, facilities, finance, each business line has somebody on this committee, and to really bring in their points of view on all of the issues that we're going to be managing throughout the entire pandemic. But now we're really focused on return to work and what does that look like. So first of all, it's a strange return to work because we have the 3 different tiers of professionals now. So our offices will probably likely never be at full capacity again, just because of the change in the workforce. But so we've looked at things from HR policies with respect to vaccinations. How do we have people come in? How do we make sure that we're staying at least initially under our 25% capacity, which is what we've deemed we feel comfortable with in our offices. Our first rollout is probably in the next month or so, where the Kansas City offices will start to reopen for our resident workers. And so it'll give us kind of a cushion to see how that goes. But so some of the safety issues, of course, are just general CDC safety issues. Are people required to wear masks? Are the social distancing? What are we doing to keep our offices clean? What are we doing to manage a lot of people coming in and getting their temperatures taken all at once? How are we going to manage that to make sure that we don't have a crowd of people standing there at the same time? And then HR policies relating to how do we talk to professionals about vaccinations, or do we talk to professionals about vaccinations? What does their flex schedule look like? What if I need time off for my children? What if I am a resident, but I still need to be home for my children right now? Things like that. We're kind of rolling out policies as they are necessary. We've rolled out a lot of them initially, but now that people are starting to really need the policy because they're thinking about coming back, we're kind of tightening up those policies, rolling them out again. The vaccinations, of course, are a hot topic. Can we ask people about them? Can we mandate them? Black and Beach has made the decision we are not mandating vaccinations, at least at this point. And so obviously this is a constantly changing landscape. So I don't want to speak out of turn and suggest that we wouldn't ever consider it, but I don't know that that's something that we have right now. So then it becomes the question of, can we ask people about vaccinations? Do we want to? What's the value in it? So that's one of the kind of more legal safety considerations we've been thinking. But it has been very helpful to have all of these players at the table to talk about this, to see how they kind of weave them together so that we're not constantly inundating our professionals with emails. We're giving them one email, one point of contact, and it has a link to this, basically this team site that contains all of the information that we have about how we're monitoring COVID, how we're monitoring our internal cases of COVID, how we're managing our return to work, both in Kansas City and globally. And then it also has links to resources like the Health Advocate and things like that that I was talking about.
That's great. That sounds awesome. Molly, from the children's perspective, Children's Mercy, do you have anything that you'd like to add at this point?
I think Andrea covered a lot. I would say, Children's Mercy did have obviously a very robust emergency preparedness model that put us into a COVID task force structure very quickly. And they have evolved and adapted as we go. And I think we are somewhat unique that we have a very large group of essential folks that do have to be here on site, and how are we going to keep them safe? And then the at-home contingent as well. So I think Andrea covered it well, but I think the vaccination question, we have also decided not to require it at this point. I think is one that I think a lot of organizations will be wrestling with as we go forward.
So, Molly, is there anything particular about, if we think about flexibility and choice, not everyone can work from home. So, especially for your essential workers, we all feel for them, and we thank them and feel for them. So, what are you thinking about relative to caring for them at this time?
We are lucky that we have behavioral health specialists on staff, but I will tell you one of the things we did twice during the pandemic, and it's probably due for its third round, is we sent a stressor survey out to our employees to kind of gauge what was stressing them right then. And, at first it was around their own personal health and safety, and then it kind of shifted into their kids and elder care. And now it's more about, well, when do I come back and how do I come back and how does that work? So I think what we have stressed is what everybody keeps saying is flexibility is critical. And, I will tell you, on my own small team, I had to tell them one day, I'm like, you guys go take a walk at lunch and get away from your desks. Because I think that people got into the habit of being tied to their Zoom. And, I was like, if you don't answer your phone when I call, you could be doing 1,000 other things, just like when you used to be in the office and you weren't down the hall. We could certainly come up with that. So, that stressor survey informed a lot of what we did. So we did do wellness rounds with our inpatient caregivers and on-site caregivers. We offered flexibility to them as well and tried to make their schedules mimic those hybrid schedules from elementary and middle and high schools, so that they could balance that child care and that parenting role as well as their on-site caregiving role. We did, at the height of the pandemic, we did open an on-site proctored learning academy, trying to help our workers that did need to be at work but had kids that were either on virtual schooling or hybrid learning, have those folks have a safe and easy place to land and to give their kids the education they need. I read one of the comments on the stressor survey that has stuck with me, and she said, I failed my kids in the spring. That was in the March to May timeframe, and this was around the start of school. And she says, I will not do it again. And I think that sentiment is what you see in a lot of women's choices, or dad's choices, to be honest. I think they've had to choose in some cases. And what our goal was is that they wouldn't have to choose, that they could find a way to put both things together and to make it work. So I think flexibility would be the key thing. And we are phasing back into in-person work for those that have been at home. So as context, we have about 8,600 employees, and about 2,500 roughly have been at home. The rest of them have been in some sort of hybrid arrangement. But we're not talking about bringing them back to the office full time. And I think Andrea said it well. We were a face-to-face organization, and I've always said that about Children's Mercy. So we have adapted quite readily and quite quickly to this remote world. And now we just have to figure out what the new normal is. And we are very conservative. We still have a 3-person in a room rule, even when you're on site. So we are trying to be very conservative about the way we bring people back into the facility and into the workplace in a safe way. But I think, again, that flexibility word, I think if that would be the takeaway I would take, Carolyn, from today is making flexibility work for everyone is the best way to start. So
flexibility and pivot, right? Those are our two favorite words now, I think. So Andrea, Molly mentioned doing surveys for the employees. So is that something that you all have done as well? And how often do you do surveys, and what information are you gathering in the surveys?
So thank you. Yes, we have been doing so we did some surveys kind of initially, right when people got sent home, essentially. And it was kind of the same thing, the stressor survey, although that focused a little bit more on what are your needs at home, or do you have everything you need? So we got a lot of comments back about, my computer setup, my ergonomic situation. How do I make sure I have my computer monitor? Can I get my computer monitor from the office? Things like that then kind of transitioned into the next phase, which was people having the concerns about the health concerns, but then the concerns about childcare. How are they going to juggle things? And is this really being accepted? So like when we rolled out the email telling people that if they wanted to or needed to, for whatever reason, to take some unpaid leave of absence, that was absolutely okay. And we spent a lot of time being intentional on making sure that our leaders were on board with this. It came from our leaders, but to make sure that our workforce really understood that this was not something that our leaders just felt like we had to offer. This was legitimately something they were offering. Nobody was going to look at somebody who took this time off and say they weren't really that dedicated to their job, things like that. So it really needed to be that tone from the top. And we have seen that in we've at least tried to put it in all of our communications and really tried to mirror that in our, throughout the process. So we've done surveys about, then kind of our more recent surveys were the work from home. How are you liking it? How productive are you? What would you need to be more productive? Do you want to come back to the office? Do you not want to? So our surveys have been more around that and what this return to office might look like. But we are probably also due for another survey to kind of check the pulse of people as to how it's going now. This has been a year. We are starting to roll people back into offices, but what does that look like, and what are the stressors that people are having with respect to that as well?
Thank you so much. And as we think about stressors and mental health, Andrea, can you tell us a little bit about the mental health first aid process and how you're using that? I think that's very interesting.
No, thank you, Carolyn. I should have mentioned this earlier, because this I thought was so I have to give credit to our employee relations group, because this is something that has been, we've been looking at it back and forth for probably, a couple of years, because anyone in employee relations understands that when mental health issues come up, they can be some of the most challenging ones. Other professionals don't know how to deal with them. Managers don't know how to deal with them. They don't know what to ask, what not to ask. They don't know how to identify them. That some of those challenges are never going to change. But with COVID and the health concerns and everything else that came with it, this became more of an issue for us. So we actually engaged a third party who is providing a mental health first aid course, which does it focuses on recognizing patterns of thoughts, feelings, behaviors, and appearance that show that there might be a challenge or a specific disorder. We're not asking people to diagnose at all. So very clear on that, but we're also providing information. So this has been rolled out to our HR business partners to attend this, and then several managers have offered and volunteered to attend it as well. And we'll continue rolling this out for all HR professionals, but then anyone who is interested in going through it. And we've had a lot of interest, which is great. But it's not just focused on identifying it. It is focused on a little bit of the stigma of it too, and the fact that people with like mental illnesses and challenges can be overcome. They can, so just because there's some major issue at one point doesn't mean that that's going to be something we constantly see, because that's something we have to address that, supervisors certainly have a concern about. So it addresses the how to identify them, what to do with them without what to do if you think that there's an issue, and then kind of just the stigmas around them and how to manage that as a move forward. And it's so far been very well received. And it's I was mentioning, I think to Carolyn earlier, that there are a lot of third-party vendors out there who offer a lot of amazing resources. So if you start to look, and a lot of them are fairly cost effective when you look at what your workforce compared to what the cost is, a lot of these costs are insignificant compared to the cost or the benefit you're providing to your workers. So I do encourage people to kind of get out there and look. If you have a question or an area that you think that is unique or is troubling to you, you're probably not the only one. So it's worth looking into and seeing if there's other resources, because almost always there are. And finding the right one is key, but just starting to go down that path to find one, I think is certainly a step in the right direction. Thank you for asking that, Carolyn. I meant to bring that up earlier.
Thank you. That's excellent. So great job to Black and Beach once again. So Giovanna, so summer is coming up. What are we going to do with these kids during the summer? What does it look like out there?
It's a really great question, and quite honestly, every summer is like that for our parents of school agers. I always call the summer my patchwork quilt of summer. I think I didn't realize how fortunate I was when my children were younger than 5, that their care was for 12 months. And many times we're left looking for what are the different camps over the various weeks that we can string together to make a full quilt that will keep everything going. And so right now, last year, we saw really a huge disruption in camps, that there really weren't very many camps offered, that they were canceled, that if they were offered, they were very slim in the number of children that they were accepting. And so really other ways were being done, maybe through collaboration with your family, if you are fortunate to have family, or maybe you just had individuals that you were trading some time with. This summer, we are still seeing that there are fewer camps than there were even 2 years ago. So more than last year, but still not as many. I'll just put it in perspective for me. With my 4th grader, we have 2 weeks so far that we have figured out what we're going to be doing. And so right now there are some resources. KCParent.com has a listing of camps that are available, as well as the flexibilities. A lot of the parks and recs are figuring out how to do camps with fewer children, or they're shortening their hours. And so that's a great resource for families to go out. But just a word of caution, in the past, they used to put out a whole booklet of all the camps that are available. And this year, they only had 22 listings. So there's not as many options. The other resource that's out there is the KC STEM Alliance. They also share about all the various camps that are available for the school-age children. And so that's another resource. But one of the camps that is typically a pretty popular camp that for the second year in a row has been closed is the Science City camp there at Union Station. And so there are more camps than there were last last year. We're not back to where we were in 2019. And I think what this means is that as this return to the office or return to work conversation is happening, that some of these flexibilities that have been in place will need to continue to be there through the summer and maybe at the start of the fall as well. And I think that's just an important reality that we just have to keep in mind as our teams are trying to figure out what does summer 2021 look like for them.
That's great. It'll be an interesting summer for sure. But Giovanna, while we have you, we have a question from our audience for you. And that is that there has been quite a bit of public anguish from parents about a lost year in their education for their kids, whether it was a remote school year or they put off enrollment for a year. From a development standpoint, is there something parents can do to help kids catch up, or is it less disruptive than it seems for kids to have been home for the past year?
Right, and that's a great question, and I think something that as we're making our decisions about what do we do with our work life, where we're trying to figure out as well. I think I heard that earlier statement from a parent that said, I feel like I failed them in those first 2 months. I'm not going to do it again. Here's the number one thing I think we have to remember is that children are resilient. Their brains are built to be resilient. If with the supports that they need, that they can get to where it is that they need to be. I think the other thing is that it's not just one group of children that's in this situation, it's all children. And it's even not in our county or our state or our country, it's globally. And so it's a different year for them. But I don't think we should call it a lost year. There are, though, some pockets that are going to be more hit differently than others. Some of the early research that's coming out, the predictions is that you're going to have some children that maybe are 4 months behind what they would have been previously, but some that are maybe up to a year. And they're saying that, you just need to face that is the reality, that there's that difference between those that were able to quickly rethink schooling. So when schools were closed, some parents putting together learning pods where they were employing a teacher might have children progressing differently than those that didn't have access to the remote learning that they would have had previously. And so I think that's a big piece, is really being able to look at those children that have maybe not had as robust of an experience, maybe not outside of school time. And so I think for parents, the number one thing, or any caregiver and anyone who interacts with a child, is to help them to love learning again. We as adults have probably said, I cannot take another Zoom today. Well, think about a child who really thrives on those social interactions to develop, having to be in front of a screen where they're not controlling what's happening, right? It's different if you're doing video games. And so I think one of the things that we have to do is help them to love learning again and to be ready to be back into that face-to-face setting and continue to offer those opportunities where learning is happening outside of the classroom as well. So for me, I'm not sure that it's lost. Children are resilient, and I think our number one role really is to help them with that learning and help them to have experiences that will continue to enhance their development.
You're giving us great hope, so thank you so much. Appreciate that. So we have a question for maybe Andrea and Molly, and I'll start with Andrea. So when you're doing these surveys, sometimes it leads to even more confusion on what to do because everyone needs or desires something different. And so now you're trying to please everyone, and you retain your employees, be attractive to new employees. So how do you decide what direction to head in?
Right. So that's a great question. I don't think there's a great answer to it. We were fortunate in that we decided to kind of go with this 3-tiered model for when it comes to the return to office. So within that, we had choices. So it would fit most people's kind of preferences. But of course, we have the people who would like everyone back in the office. I mean, this is just one example. These surveys address a myriad of things, but we have people who want to be back in the office 100% of the time. And, we provide the data, we provide the information as behind the decisions that have been made. And we basically acknowledge and own the fact that we are not going to be able to make everyone happy with every decision. We're trying to find the way for us to provide the best services to our clients, to be the most productive, and to have our employees the most engaged. So certainly that's going to leave some people behind if that wasn't the track they were, one particular area that they didn't like, if it's the full return to work or whatever it might be. But those were kind of the things we considered when we made the overall decisions, is what best moves us in that direction. And as long as it moved us in that direction, we felt like we were making the right decision. And then we explained it. I mean, we didn't provide, not in great detail, but we explained the rationale for the decisions we had made.
So Molly, how about you?
I would somewhat echo what Andrew says. I think with any survey, it's around communication, both what you heard them tell you and then what you are able to do and what you're not able to do. And I think it's being honest and transparent with them that we cannot solve all of their problems, but we can point them to resources. And a lot of those resources were available through our employee assistance plan and a lot of other benefit resources that they just may not have had to access before or been aware of. So a lot of it was around communication and making sure that they knew what they did have versus focusing on what they did not. I think we have to sometimes flip the script to the positive and think about what we have been able to do and what we can do versus focusing on those things that we cannot for everybody. But I think those surveys gave us the big picture of where our time and attention should be felt or should be spent, and where the biggest needs and the biggest stress that was being felt in the organization, where it led, so we could address that first.
Thanks, Molly. I think you're right. There are we've noticed a huge increase in volume of employees just trying to find out what they already have. So employers have been doing lots of things to get us to this point, and now are doing even more. So that is definitely something that we've seen as well. So I have a question, and it is for Andrea or Molly, and this is a good question as well. So, and I'll start with you, Andrea, again. What have you been able to do to support managers during this time who are really dealing with it from all angles?
So so we have, again, the whole myriad of personalities with managers, as I'm sure everyone does. So we start, I mean, basically this has again been the tone from the top. As a manager, you need to be flexible. You need to have these, provide these flexible schedules. You need to work with your people. When we say that somebody is flex, I mean, that's one of our moving forward, that's one of our classifications as a flex worker. And they say, what does that mean? What days do they have to come in? And what it means is you need to be flexible. So really working with them to understand, but the reality is a lot of our managers are the people dealing with these same issues. So it's not, it's not foreign to them that they're going to have to manage other people's schedules. But I mean, we do get a lot of requests for being very kind of prescriptive in what can we and can't we say, what can we and can't we do with respect to when they come back, can we require people to come back? So that communication, I think, is a little bit more challenging because people do want very, very clean lines and somebody to tell them yes and no as to what they can and can't do. So that's where that flexibility comes in, and it becomes challenging. That flexibility is not easy at that point. It's a little bit difficult to push through, but we're trying to support them just like we support all of our other professionals.
Thank you. How about you, Molly?
I think we have to worry about our managers a lot because they are having to take the brunt of the day-to-day. So we've done a lot. Like I mentioned the wellness rounds, but we have had several wellness Zoom chats for leaders where we've had leaders share their own personal stresses and journey through it and just shared and let other people hear that they aren't alone and that they're not the only ones feeling the way they are and that they're not the only ones facing the same challenges and trying to manage not only their selves, but their entire team. And I think that that's so important that they find that it's okay not to know it all. It's okay to say to your team, I don't know, but I will find out and we will work through this together. And I think it's made a lot of our managers grow, but I think support through groups, both formal and informal, and I think support from the EAP and support from leadership. I would echo Andrea, it comes from the top that we want you to take care of you. Again, in our world, it's we want you to take care of you so you can come take care of the patients and the families that we serve. So we want to make sure that our workforce is ready and not distracted when they come in to do that care. So I think it's about just providing resources and support and trying to reach out and make sure that everyone feels like they're taken care of.
Thanks, Molly. So Giovanna, one of the things we're thinking about is helping employees who are going to be remote workers, maybe even from now on. So what kind of support or best practices or guidance, places to go for good information? I know I've tried to, in working from home, set up a routine that I stick to all the time, but what other advice is there for that group?
Right. Well, and I think part of it is some of those simple things around communication. I think sometimes when you are that individual that's working at home with little ones, or if you're caregiving for older adults, your routine isn't always the same. And so I think the word flexible has been used quite a bit, but I think it's that piece and having ways that people don't always have to ask to make the change, but there's some free flexibility for them to be able to do that, but yet a way that they're communicating that with others. I think that has been one of the biggest pieces, just even in my work that I've seen. My department has 33 people. Of those 33 people, 31 are women, and a majority of those women have young children that they're also working with. So part of it is, instead of each of them having to communicate with me every day about their schedule, we really look at that calendar and how do we have that. And then we also, if there's a baby that's in the picture, we enjoy that time. You know, that's something that we would not have had previously. So let's enjoy some of those moments that we wouldn't have had, being able to see a baby grow from a newborn and now a year old, you know, as it's happening. And so I think that's part of it as well. But I also think just that piece of really providing what are those maybe blocks of times that are there for that direct communication, and then what are those times that maybe need to be reserved for work that is a little bit more just the employee needing to do. So there is that opportunity to say, this is a good time to check in, and these might be times where it's a little bit more difficult as well. But I think along with communication, it's that flexibility.
Andrea or Molly, do you have anything you'd like to add on that point? Here comes Molly.
Sorry, Carolyn, they just started hammering right next door to me. So what I would say is one of the things that we did to embrace the crazy, as we put it on we actually had our kids host our daily huddle. And it was great fun to see them just participate and get involved in the workday. And they have a lot of fun. They keep asking when we're going to let them take over again. But I would echo Giovanna. It's been so fun to see these kids grow and what they're working on and what they've been doing in school. So I've learned a lot, and I've had a lot of fun getting to know the families of my team just a little better.
I agree with that. We're giving them some good experience right now too. And it is so fun to see them. It's take your child to work day every day, it seems. So nothing wrong with that. Andrea, I do have a question for you about travel, business travel as well, or you can answer about the last point, or how are you helping those who are having to travel for business? And I'm just curious too, if you look on the whole international scene, what are the differences happening out there between what's happening here and what's happening in other places?
Right. So first, on that last note, I did want to kind of echo what everyone else said. I think everyone has embraced seeing people's families. And there is an element of, we don't get to see people in person, but we are learning more about who they are because of where they are and, watching cats walk across keyboards during meetings and kids who need to, help to the FedEx delivery person. So I think there, it's that a little bit of comedy and a little bit of humanity that we're brought in and just understanding how people are, because you see them a little bit more in the workplace. With respect to travel, so with 5 minutes left, I could probably talk about this for an hour, or at least our travel team and safety team certainly could. So we put a lot of restrictions on travel initially. First, well, we put a lot of restrictions on travel in February of last year when it was international travel. And then a lot of those were mandated anyhow. So we've certainly seen an uptick in travel domestically. And so we still require that it be necessary travel. So we're not having people right now attend conferences and things like that. You've got to have permission from your department head, and you've got to justify why you need to go there. The international, I mean, I don't know that I could even really speak on that in the next 5 minutes, because every country we're seeing is different. Some countries are not allowing international travel. Some countries are allowing it, but when you get there, you have 2 weeks of quarantine. So we have to be really thoughtful if we're sending someone, particularly in places in Asia, where they leave, they have 2 weeks of quarantine. They're wherever they are for as long as they need to be, but then they come back and they have 2 more weeks of quarantine. So if that means working from home and they're effective doing so, then that's great. But a lot of times that chews up, I mean, we're talking about 4 weeks of time where people are unable to go to project sites and whatnot. So we really have to look at whether that makes sense or not. But our guidelines at this point have not changed since we rolled them out in, this time last year or earlier, but we're constantly looking at them as far as the CDC, but also on a global scale in the countries where we're doing the most business, to figure out what we need to be doing to make sure people are safe when they travel. That being said, I don't think we're ever going to get back to the amount of travel we did before, because people are finding that Zoom calls and Teams meetings are very effective. So there are certainly times for face-to-face meetings, and those will continue to happen. But I think there's going to be a lot more international or even domestic, just across, doing everything from Teams, meeting people on an occasional basis, but doing it from Teams or Zoom or whatever it is, because we've found that we can be successful doing so.
So true. Very interesting. It's who would have thunk, right? So Molly, I'll ask you this question. And how do we balance celebrating employees with kids and providing them all this flexibility while not unintentionally alienating other employees without children, and making sure they're also allowed flexibility?
Yeah,
very good point.
Yeah, I think it's a great point. And I think it's one of the things we talk about quite a bit. I think it's about emphasizing that flexibility for all. It's not just because you have a child, it's because you may just need flexibility for, I even say, a pet or a parent, or, just a good friend that needs you that day or needs your care and guidance. So I don't limit it to children. And I think that's where people tend to focus, because I think that's where the most of it is. But I have walked through a couple of elder care situations, and to me, those were way more traumatic, that were in care facilities that couldn't be visited for almost a year. Those were almost more traumatic than some of the child care issues. So I think it's about making sure that when you roll out these things, it's not a child care program or it's not a this program, it's a flexibility program, and it can be adapted to the needs of the individual. And that's where the adeptness of your manager is being able to understand and apply the flexibility rules equally is very important.
So true. Giovanna, do you have any thoughts on that as well?
I think she echoed just what I was saying, is that it truly is a universal design. And I think if we can keep that in mind and know that we all need flexibilities, whether it's for self-care, to take that break for mental health, or to rearrange because you need to get a little something in before your typical workday starts, I think it's really important to think about just really flexibility for all.
Well, as I said, we had some amazing panelists, which you all have proven me right. So thank you so much. I really appreciate it. I want to thank each of you and thank all of you who are out there who attended. A special thank you to our webinar sponsors, who are Casey Rising, the Civic Council of Greater Kansas City, the Casey Chamber, the Mid-America Regional Council, and the Kansas City Area Development Council. The webinar has been recorded, and the recording and the slide deck will be provided to attendees soon. Thank you to each of you, again, our panelists. Our next webinar in the Safe Return series, hosted by Casey Global Design, will be Wednesday, May 19th from noon to 1, and we'll share insights from architects, engineers, and global property owners on the future of office space and operations, which will be very fascinating. So looking forward to that. So thank you all for attending and have a great rest of your day.